Are you feeling tired? Are you using the restroom very often? Like, are you peeing a lot? Are you feeling more hungry than usual? Or are you losing weight? These could be very subtle signs of diabetes. As you know, at least 50% of Americans have prediabetes or diabetes, and it's increasing in the population. And according to CDC, diabetes is a lifestyle disease. Hi, I'm Dr. Mini Malhotra. I'm the medical director at Anchor Wellness Center, and today I'm going to talk to you about diabetes, what symptoms, how can you diagnose it, and what are the steps you can take to help reverse your diabetes or at least balance your blood sugar without being on prescription medication. And I'm not against prescription medication. If you really need it, it's a very good tool to have. But not everybody requires prescription medication, and you can reverse many diseases just using diet and lifestyle and the right nutrition tailored to your needs. So diabetes, there are two types of diabetes, type 1 and type 2. Type 1 is autoimmune diabetes, usually occurs earlier in your life, sometimes in younger children, teens, adolescent, young adults, and even in your 30s and 40s. It's an autoimmune condition. That means you have antibodies that your body develops against the pancreas and which damage the B cells, and so you cannot produce insulin anymore, and they are insulin dependent diabetes. The second is the type 2 diabetes, which is more common. It has genetic origin, it has some genetic component, it runs in families, but that doesn't mean that you will have to get it. You can always change your nutrition according to a way where you can reduce insulin resistance. The key factor in type 2 diabetes, which I'm going to mostly talk about, is insulin resistance. Now, what does that mean? That means your body has insulin, is trying to cope up with the high blood sugars by producing more and more insulin, but your cells receptor for insulin is not working, and so it cannot push the sugar in, and you have surplus amount of sugar floating in your blood. That's the type 2 diabetes and insulin resistance. Insulin resistance is very complex, and it cannot be explained in just a short video. I'll talk to you one day only about insulin resistance and what are the diseases that insulin resistance can cause. So, how is diabetes diagnosed? It is diagnosed by a few simple blood tests. You can do a hemoglobin A1C, which is the average of your blood sugar in the last 3 months. It's diagnostic, but still not the best test. The best test for diabetes is 2-hour glucose tolerance test, where they check your blood sugar and before you eat, and then they give you a loading dose of glucose, about 50 to 75 grams of glucose, and then they repeat the blood sugar in 2 hours, in an hour, and then again 2 hours, and they see what your results are. And every lab has their ranges, and you can be diagnosed directly by that 2-hour glucose tolerance test. Another test which is very important is insulin. So fasting insulin, and after you eat, what your insulin is. Another is C-peptide, which actually tells how much insulin you're producing from your pancreas. So these are a few tests which can really diagnose diabetes accurately. It can also show your insulin reserves. So how is diabetes treated? Usually the type 2 diabetes, you start with oral medications like metformin, and then there are the newer one, the SGLT2 and the Januvia and other medications, and then there are more newer medications like Manjaro, the Ozempic, which are the injectables. So there are injectable too, like Trulicity. All these medications actually help balance insulin resistance and help you with your blood sugars and manage your diabetes. So these drugs are only managing your diabetes, okay? If you really want to reverse your diabetes, you have to have a very focused approach, and your nutrition needs to be on point. So number one is nutrition. So eating low carbs may not always be enough. You have to know the right carbohydrate, what are the high glycemic index, that means which foods raise your blood sugar a lot, which foods can maintain a lower blood sugar, and low glycemic index foods. So those are the foods you should eat more. And that includes all leafy green vegetables, most vegetables except the starchy vegetable like potatoes and squashes. Then your grains, most of the grains are high glycemic index. The lower glycemic index are some millets like ragi flour. That's low glycemic index. Then, of course, dairy products are low glycemic index food. You also have non-dairy products like almond milk, almond yogurts, coconut milk, coconut yogurt. They are also very, very helpful. And of course, meats, they have mostly protein. So chicken, fish, turkey, those are good foods to eat. In the fruit section, you have to limit your fruits mostly to berries, because fruits have high glycemic index, especially fruits like mangoes, grapes, bananas, watermelon, cantaloupe. These are very high glycemic index, so it should be avoided. Have more berries. You can have apple, oranges. Those are fruits that you can include in your diet. But it has to be done with the help of a nutritionist or a practitioner who understands nutrition well. Second is exercise. Exercise is an excellent way to reduce insulin resistance. Any form of exercise, 30 to 45 minutes of moderate intensity exercise, including strength training, will really be helpful to reduce insulin resistance and balance your blood sugar well. Three, reducing stress, because when cortisol increases, it increases insulin and that increases your blood sugar. So, mindfulness, meditation, deep breathing exercises, they all can be very beneficial. Four is getting good quality sleep is really important. And of course, last but not the least, you have to have good gut health, right? So the 5R protocol, where you remove inflammatory foods, you repopulate good bacteria, you rebalance your body, you repair the gut lining, and you replace anything that is missing, like digestive enzymes or stomach acid, to help you digest your food well. So if you pay attention to all of this, it will be really, really beneficial to reverse your diabetes. And last but not the least, hormone balancing. So as we age, we lose major hormones. In females, estrogen, progesterone, and testosterone. In males, testosterone is a major hormone. And when they start to fall, then your blood sugar levels, it increases insulin resistance, that increases blood sugar levels. So get your hormones balanced. So those are the few steps you can start taking. Another thing that is really popular is time restricted feeding. So you're restricting your feeding window to about 6 to 8 hours will really help in, not only cutting back calories but also reducing insulin, because you're not needing insulin the time you're fasting. Okay, but you have to be very vigilant about your blood sugars, and you have to have your provider or your physician on board with whatever you're doing. Never do something that is really, really going to harm you. And if you are taking insulin, you really need to be monitored well when you're doing this time restricted or intermittent fasting, which they call. Okay, and then there are some people who do prolonged fast, like 3 to 5 days, which should be done under medical guidance if you're a diabetic, and especially if you're taking insulin and other medications, which need to be tapered or stopped if the period you're fasting. So if you're looking to reverse your diabetes, you can consult a functional medicine practitioner. If you want to work with us, you can book a strategy session with us and we'll be happy to help you. And I hope you like this video. Please share this video with anyone who would be helpful for them. If you're liking our content, then please subscribe to our channel and give us a like. And I have also recorded other videos which will be really helpful and beneficial on your healing journey. Take care and have a great rest of your day. I'll talk to you soon. Bye.